Live. I'm Chef AJ, and this is where I introduce you to amazing people just like you who are doing great things in the world. Today's guest really needs no introduction, but in case this is your first time watching me, today's guest has been helping thousands upon thousands of people for over 40 years regain their health and appearance. He's written multiple best-selling books, and he is just my hero as well as the hero of many other people, and has made it possible for the little people like me to actually have a voice in this world, teaching people like he has what is the correct diet for the human. Please welcome Dr. John McDougall. Thank you so much for taking the time to talk to my viewers.
Well, thanks, AJ. It's good to be with you. Always fun to be with you because it's always exciting. You know how to mix things up. And I hope you bring some controversy into this particular talk. Lots of things have changed, and we live in a whole new world. And I think most of your listeners have come to the conclusion that the world's never going to be the same again. So we've had to make some adjustments. And what I'd like to share with you is some of my adjustments in thinking that I've been making over the last, well, it's actually been going on for an awful long time. But it's really been focused, my thinking, since January of 2020, since the COVID-19 crisis. And that, of course, has changed everything. One particular thing that's changed for us is our whole business model, AJ. You know, we used to run a program where people traveled all the way from around the world, all the way to California, either to come to my St. Helena program at St. Helena Hospital, or to come at our resort in Santa Rosa, California, where we took care of people for the last 18 years. Which has been a lot of fun. And we have scientific research that shows the benefits of this program, both independent research from Oregon Health and Science University, as well as independent research from New Zealand, as well as research that we've done for ourselves that proves the benefits of this program. The problem, AJ, is that in January of 2020, everything changed. People could no longer travel easily to our program in Santa Rosa, California. People, plain and simple, didn't want to travel. Airlines were not around. The idea of staying away from home for 12 days in a strange place. In fact, even our resort was physically shut down because of this pandemic. Well, we decided this is time, in fact, long overdue, for us to make some adjustments. And that is to bring our program even more conveniently to people. Prior to this, people had to travel by planes and cars all the way from around the world. And then they had to stay in a hotel away from their family and friends. Well, we've changed all that. We put together a 12-day telemedicine, teleeducation program. And we spent the last 6 months developing this program. And in this program, we're going to teach you the same principles, cause the same kind of changes that we tried to get you to accomplish when you came to our Live-In program. Now, we have our medical doctors. Dr. Lim will be seeing an awful lot of patients. We have other McDougall trained doctors that will see people by telemedicine. This is the modern way to practice medicine. It should be a much more convenient way for you to practice medicine. You should feel more comfortable about the doctor-patient relationship under telemedicine. After all, you don't have to drag your body to the doctor's office to be under the doctor's rule, to have a situation dominated by your physician. You want to be in a situation where you can share in your future, where you can plan together, work together to accomplish your goals. And so by coming into your home with our medical doctors, we'll be able to accomplish this. And also we have our education in a very personal manner. The whole McDougall team realizes that you need help. And so as a result of our understanding, we've been doing this for 34 years, as well as, because of our understanding of how much help people need, we've made the program very personal. A lot of interaction, a lot of support along the way. So if you're interested, we're starting our first program August 21st, 2020, and we'd be happy to have you join us. So the other big benefit of the program is we've been able to cut the cost more than half. So, I mean, how can you refuse? Anyway, any questions about that, AJ, about the program we're running?
It sounds amazing, and it's so affordable, and it's like you say, even if we didn't have the pandemic, for a lot of people, travel is difficult. They have children, and this is going to be amazing. And I've posted all the links if people want more information in the show notes.
Good. Well, let's get on to the topic that I've been thinking about for an awful long time. It's really been focused since this whole pandemic started in January of 2020. And what this has been able to do is to tie a whole bunch of my life's work together. And I'd like to present this to you in a slide presentation that I think is in a good enough form for your viewing. Let's take a look here. All right. So as I see it, what you have in this current pandemic is you have a toolbox that contains basically two tools. You have the ability to social distance yourself. In other words, wear masks, wash your hands, stay 6 feet away from each other, and so on. And I don't want to minimize this. Is very, very important. The only other thing that you have in your toolbox, and most people don't know about this, is a healthy diet. And I'll use the McDougall diet, a starch-based diet with fruits and vegetables, as the ideal as far as the healthiest diet for all the things that I'm going to talk about. I want you to consider the fact that you don't have, let's see. Well, AJ, let's see.
The button is probably the button on the very low right of the keyboard. It's the arrow that goes to the right, I'm thinking.
All right, let's see if we can get it to work this way. There we go. How's that?
Perfect.
All right. So anyway, there are three main problems I want to discuss with you, and they're all tied together. There's this COVID-19 pandemic that's going on, and the solutions, as you realize, are low tech. They're isolation, social distancing. The idea that we're going to have Star Wars, medicine, science solutions, high tech, the idea that we're going to have vaccines and treatments is something of hopes and dreams. It's something you cannot count on, yet that's what people look towards rather than the simple approaches. When it comes to the chronic diseases I've been treating for the last 40 years, rather than a low-tech, starch-based diet, exercise, and some sunshine, people are looking to be saved by doctors, by drug companies, by device companies, Star Wars medicine, Star Wars science. And it's the same thing with climate change. We could deal with climate change by reducing CO2 production in obvious ways, and also by a starch-based diet. The idea that we're going to reduce carbon, this climate change problem by carbon capture is some of the biggest nonsense that I've ever heard. So what I'd ask our viewers to do is to get down to a simple understanding that the truth is simple and easy to understand. We need to look at the available low-tech solutions. They're low profit, that's part of the problem. And we have to do them. But this is the technology that we can save ourselves with, and that's low-tech solutions. Now, I would like to tie these three problems together, and I want you to understand that the denominator of these three problems is the diet that we eat. The truth is all interconnected. What I'm going to try and share with you, and this is a very important part of this discussion, is that diet is the cause of the chronic diseases that most of you haven't had experience with. You've either personally experienced healing by changing to a starch-based diet, or you know somebody, or you're in the process of trying to change and heal chronic diseases such as obesity, diabetes, high blood pressure with a starch-based diet. Well, one of the things that I'm going to talk to you about is the most powerful tool that we have in terms of climate change is switching to a vegan, low-fat, starch-based diet. And the third issue, which is tied together, which you may not have thought about, which is the issue that's going to bring people to their attention, is the fact that whether or not you catch, as well as whether or not you progress to severe complications of this infectious disease, complications such as hospitalization, the need for a mechanical ventilator, and or death, whether or not you progress depends upon whether or not you're healthy, whether or not you've developed comorbid factors that are easily treated by the McDougall diet. The first half century of my life, I focused on treating chronic diseases. That's probably what you know me best as the doctor who takes care of people who have diabetes, high blood pressure, overweight, even dabbling in cancers, and of course, multiple sclerosis. I've been doing that for 40 years with great results. And the diseases I've been focusing on, I've classified as diseases due to food poisoning. The American diet poisons people, and the way we solve the problem is we remove these poisons from their environment, their dinner table, and replace them with foods that support health, and as a result, they get well. Here are the diseases of food poisoning. They are obesity, which results in complications such as high blood pressure, diabetes, heart disease, and cancer. They are problems such as atherosclerosis, leads to heart attacks and strokes and impotence. Problems of various kinds of inflammatory arthritis. Even degenerative arthritis has part of its foundation in diet. Various kinds of cancers like breast, colon, and prostate cancer. Constipation, indigestion, all kinds of bowel problems. These are the kinds of diseases that you know me best for. These are what my 13 past best-selling national books have been about. It's about healing these kinds of diseases, chronic illnesses, by switching to a starch-based meal plan. Now, we published our results. We published our seven-day results on 1,615 people. The average weight loss was 3.1 pounds while eating an unrestricted amount of foods. The average cholesterol reduction was 22 milligrams per deciliter. Now, keep this in mind, because we're going to talk about this later. The average decrease in blood pressure was 18 over 11 millimeters of mercury in people with high blood pressure. And most of those people came in on blood pressure pills. The other thing we found in this study is nearly 90% of people were able to get off most of their medication, particularly their blood pressure and their diabetic medications. Now, our program was also studied independently at Oregon Health and Science University. That's the medical school in Portland. And what they found in a one-year study, this was a study dedicated to multiple sclerosis and diet, but what they found was the average weight loss in 1 year was 9.1 pounds. The average cholesterol, 19.1 pounds. The average cholesterol reduction was 19 milligrams per deciliter. There was a reduction in insulin levels, which of course is related to diabetes, and of course fatigue levels. And one of the surprising findings, but very important findings, is that over a 12-month period of time, we were able to show, or the Oregon Health and Science University was able to show, that our program, people were able to maintain a compliance of 85%. 85% of them were able to comply with the diet over a 12-month period of time. Now, a study was done in New Zealand called the BROAD study. And this was a study, a community study, where they put people on the McDougall diet for 1 year. And what they found is a 25-pound weight loss for 1 year. And you have to realize, just like at our program, they didn't restrict the amount of food that they ate, and they really didn't mandate any regular exercise. And that's the typical program that we teach. Cholesterol reduction at 12 months was about the same as we found, 20 milligrams per deciliter. Medication usage decreased. Compliance was quite great. And people attended the sessions that they taught in the community. So this kind of program can be run in an outpatient, doesn't have to be run in a residential setting. So let's go on to the next phase. For the past 16 years, I've pined over the fact that my grandchildren and children have virtually no future. And it's due to climate change. It has really made me upset, depressed, sometimes incapacitated, sometimes sleepless. The idea that what we've done, which may be incorrectable, but I'm not going to give up trying, what we've done to the environment, and that's been done, of course, by modern civilization. But most importantly, as far as our viewers are concerned, is that this destruction of our environment is tied directly to our eating habits, to our diet. What we found as an overall assessment is that CO2 production, which is the atmospheric gas, one of the primary atmospheric gases, is mostly produced in the livestock industry, whereas there's comparatively very little production of CO2, even in rice. Even in rice, as far as the greenhouse gas productions in the plant agricultural community, or the agricultural segment of our society. In November of 2006, the World Health Organization came out with Livestock's Long Shadow, their 417-page report, which told us that 18% of the world's greenhouse gases, as measured by CO2, were due to what we ate, and that's compared to about 14% due to all transportation. Then the World Watch, then Al Gore came out with his Inconvenient Truth. And I was quite moved by his documentary, as I hope you were, but I was also troubled by the fact that Al Gore did not tie the destruction of the planet to the livestock industry, possibly in part because his diet at that time was not a healthy diet. He was a black Angus farmer in his past. So he had some prejudices that would allowed him to leave out, either not intentionally or intentionally, the connection between the livestock industry and the environment. The next big step was the World Watch Institute, which in about 2001 declared, after reviewing the World Health Organization's findings, they came to the conclusion that instead of it being 18% of the greenhouse gases produced by the livestock industry, it was more like 51% or more. Since then, we've had Greta Thunberg come out and protest, talk to the United Nations, try and move our adult population into consciousness as far as the importance of climate change. She, again, is not a person who has been particularly focused with diet and its implications in climate change. The Eat Lancet Commission, they came out in January of 2019, said we have 8 to 10 years left, and then it's too late, folks, to make necessary changes. So what it boils down to is that what we eat has a big impact. It has an impact on the economy, it has an impact on the environment, it has an impact on our personal health, and the best kind of diet to eat is a vegan diet. In fact, estimates show as great as an 80% reduction in greenhouse gas production by changing from the typical American diet to a vegan diet. Well worth our trouble. All right, now getting on to the new part of the lecture that may be the only one that you're really paying attention to, because that's pretty much all people are paying attention to. And that is the world's eyes are on the COVID panic, are on the COVID pandemic. But what they don't realize, most people, is that this particular pandemic is can be mitigated by changing to a healthy diet and becoming a healthier person. Well, there's been a lot of focus on how the meatpacking industry is a vital industry and how the meatpacking industry also has a concentration of COVID infections. Well, folks, you all know that meat is not a necessary nutrient for the American society to survive in. In fact, it's a double insult to the people who have to work in this industry, to force them to work under unhealthy conditions and to be told that they're making a product that is necessary for the good health of people of this planet. That's not true. In fact, it's just the opposite. Your diet has a big impact on whether or not viruses and bacteria affect you. In one way, the diet influences what we call the brush border of the gastrointestinal tract. This is a 1-cell layer thick border which determines whether or not microbes can get through into the body, into the bloodstream, into the tissues, into the lungs, etc. Whether or not this border is intact and does its job like it should depends upon what we eat. If you eat a healthy diet, what happens is the border is intact. An unhealthy diet will take and destroy this border and make it permeable. The benefits of these chemicals are questionable at best, and like any chemicals taken individually, they may have positive effects, but then again, they're going to have adverse effects. The way that these chemicals are safe and most effective is for you to take them in their natural packages, which are their fruits and vegetables. There's a lot of talk these days about how people who have COVID-19 infection, many have a disease that is asymptomatic and they don't seem to have any particular manifestations, but others go on to have severe symptoms and more severe symptoms that result in hospitalization. And eventually, too many people end up on mechanical ventilators, and that is often a death sentence. So early on in the China epidemic, it was noticed that there was a relationship between what we call pre-morbid conditions, the conditions people had before they died. And what we found is the risk of going on to severe complications and death were much greater in people who had underlying cardiovascular disease, diabetes, chronic respiratory problems, high blood. These are all diseases that the McDougall diet has treated for 40 years, for 50 years. in a residential setting for the last 34 years, and in an internet telemedicine, teleeducation setting, we have hope to teach for many decades to come. A diet that cures these premorbid conditions and certainly prevents them 100%. Well, the Center for Disease Control came out June 15th of 2020 and reiterated this statement. They said your risk of hospitalizations was 6 times higher if you have the underlying conditions such as obesity, heart disease, kidney disease, and diabetes. And the risk of death is 12 times higher among people who have these particular conditions. So just a couple of weeks ago, this same statement was reiterated in Europe. The editor of the British Medical Journal, Dr. Fioni, she came out and said, we need diets richer in whole grains, fruits, vegetables, and legumes with less red meat, refined carbohydrates, and highly processed foods to prevent severe complications of COVID-19. And let's take a look at what Dr. Fauci has to say.
We know from a lot of experience now that the situation regarding whether or not you have serious consequences, hospitalizations, intubation, complications, and death relate very strongly to the prevalence and incidence of underlying comorbid conditions, which are clearly disproportionately more expressed in the African American population than in the rest of the population. And that particularly includes hypertension, diabetes, obesity, chronic lung disease, and kidney disease. So unfortunately, we have a situation where it's sort of a double whammy of a negative capability of them to respond through no fault of their own because of underlying conditions and the conditions in which they find themselves with.
Yep.
So what you should see is that there's a general agreement worldwide that the conditions caused by the Western diet and those prevented and cured by the McDougall diet and similar low-fat, vegan, starch-based diets are the same conditions that will prevent you from going on and having severe complications. Now, I'm not going to go so far as to tell you that it's 100% preventative or as far as complications go or catching this disease. I'd be foolish to say such a thing. I'd be just as likely to be the one person who caught the problem. Anyway, what keeps me tied to this progression of COVID-19 is the underlying comorbid diseases, which have also been highly associated with a risk factor known as cholesterol. Now, cholesterol may be a marker as far as whether or not a person will go on and have more severe disease. It could be just a marker, and I think it probably mostly is. And that marker is suggesting that person is generally unhealthier, so that person can't defend themselves. But people like to have specific mechanisms and details as to how a particular condition occurs. So this mechanism, along with this paper, can explain to you how the rich Western diet, at least one component of it, the cholesterol, is implicated in progression to a more severe form of this disease. In the cell walls are what we call lipid rafts. They're identified as ACE2 bridges. And these lipid rafts, what happens is that's where the virus, the COVID-2 virus, passes from the bloodstream, say, into the lungs. Well, whether or not that bridge is permeable depends upon the cholesterol load in the body. People who have a high cholesterol load will end up having progression of the disease, and this mechanism explains why, because the cholesterol attaches to that particular lipid raft and allows the easy transfer of the virus into the lungs. I hope that helps convince you that the science is solid enough. Certainly it should be for you to make the changes that are recommended. The average cholesterol, as I've mentioned, average cholesterol changes I've mentioned in the McDougall program, looking at 1,600 people is about 22 milligrams per deciliter. I believe that the benefits as far as COVID-19 severity, they begin immediately by changing your diet. The reason I believe this is because of my half a century of experience in dealing with the human body and seeing how quickly it heals. The COVID-19, in my opinion, has been a blessing because it's caused people to open their eyes. I call COVID-19 the comet we've been waiting for to save the planet. If there was a comet heading towards the planet that was arrive here in 4 to 6 to 12 months, we as a species would gather together. Chinese, people from India, Europe, the United States would gather together and build some kind of interfering satellite to stop that comet. Well, ladies and gentlemen, COVID-19 is that wake-up comet. You know, we have a chance to make changes. Whereas if we were dealing with climate change, by the time we came to a similar understanding about our abilities to change, Florida would be under 20 to 40 feet of water. It'd be way too late. So let's take this opportunity of COVID-19. What have we seen in the last 6 months? People worldwide are able to make dramatic changes in their behavior. We're able to shut down the polluting airlines, the polluting CO2 industry. We're able to start thinking out of the box. You know, the ability of the human being to respond to an acute, obvious situation, such as COVID-19, is, well, it's amazing. It should be surprising and appreciated by all of us. We can change. And also, we've seen the impact on the environment. We've seen the sky become blue over China. We've seen the waters become clear in the Venice Canal so that we can now see the fish. Animals are running around where they never ran around before. We have a possibility in front of us, and we don't want to miss that possibility. Now, can we do this? I want to end this presentation by talking about whether or not this is a practical thing that people can do. Can we make these changes when required, when requested to do so? The real reason to make these changes is to save the planet, the future for my children and grandchildren. The immediate reason that most of you are going to do it is because of the COVID-19 protection. The long-term reason you should have been doing it for the last 40 to 50 years that I've been trying to teach it is to save yourself and your family from chronic diseases. Can we change? Well, let's look at lessons from the past and see the ability of people to change is. During World War I in Western Europe, we had the blockade of the Northern Sea put up by the British. And the idea of this was to starve the Germans. In the process, because Denmark was in between these two countries, the people of Denmark also were under severe restrictions. This was a period of 1914 to 1918. During that period of time, the Germans kept with the basic 4 food groups. The idea that you needed to eat meat and dairy and have a well-balanced diet. During that period of time, nearly 400,000 Germans starved to death. However, the Danes had a different story thanks to this man. This is Dr. Mikael Hindhede. Dr. Hindhede was a famous nutritionist. He did a lot of research on protein. He discovered that the requirement for protein was so small that it was impossible for the human diet to reach such levels. And therefore, he wasn't concerned about protein at all in his nutritional experiments. Well, the World War I came around and the blockades were set up and food became scarce. And instead of asking people to eat less food, what he asked them to do is to stop eating their animals. The pigs died of starvation. Only wealthy pig farmers got to eat pig during that period of time. Only wealthy people in Copenhagen got to eat beef during that period of time. The whole country gave up animal foods and instead ate the foods that the animals ate. The consequence was, during that period of time, as people became healthier. On soybeans, on potatoes, on various grains, they became healthier. And he published his results in the Journal of the American Medical Association in 1920. What they showed during that period of time is a dramatic reduction in death rate, of overall death rate. And that you see in black. They showed a 34% reduction in chronic diseases like I've been treating for the past 40 years, but they also showed a reduction in infectious diseases. There were nearly 6,000 fewer deaths among 3 million people during a 2-year period of time. That's the lowest death rate they've ever seen in Denmark. Well, I want you to also notice that during that period of time occurred the Spanish flu. And the countries in Western Europe suffered from the Spanish flu, and there's a lot of similarities between the Spanish flu and the COVID-19 epidemic. No vaccines for prevention, no miracle drugs for treatment. The Spanish flu killed between 20 and 50 million people. Estimates could be as high as 200 million based on our population. They had only social distancing and contact tracing and face masks, just like in our toolbox. But the population in Copenhagen, in Denmark, they also had the advantage of a diet similar to the McDougall diet. As a result, if you look at the pandemic, the Spanish flu pandemic between 1918 and 1919, if you look at the death rate in various European countries, you'll see a pattern that reflects the diet that was consumed during those countries. The Germans had a very high death rate from Spanish flu. Italians, England and Wales, pretty much like we have going on these days. Denmark had a low death rate from all diseases, including the Spanish flu. If that isn't enough evidence to convince you it's time to change your diet, I don't know what is. Well, why does this work? I have to tell you, in 50 years of taking care of people this way, I've learned that we do a good job as medical doctors when we treat acute problems like lacerations or broken bones or infections. But we do a terrible job when we treat chronic problems, which are due to repeated injury to the body. For example, the way you cure a chronic smoker from his or her cough is to get them to quit smoking. They're acutely injuring themselves 20 to 40 times a day. You stop that behavior and they heal. As long as they continue the repeat injury, they never heal. They continue with a chronic illness. And so it is with shoveling cholesterol and fat into your artery walls and your tissues. But once you stop doing that, the body heals itself. Well, my understanding of the miracles of the human body are easily transferred to the rest of nature. And I see that nature also is being injured multiple times a day in every part of the world. And if we stop that injury, the ability of the planet to heal is substantial and hopefully enough. Certainly, I'm not going to give up my optimism. I'm going to keep my optimism and hope and my belief that people like AJ can take and carry this message out, teaching people to be too fat, how not to be too fat, too overweight. It's a good thing. And if that leads to prevention of COVID-19, AJ, I think that's a great thing. And if you end up having people not suffering anymore from arthritis and diabetes and so on, you fulfilled every dream of every doctor. But to accomplish the goal of giving a future to our children and grandchildren is really what ought to all be focused upon, because that's all too real. Anyway, AJ, thank you for giving me a chance to share with people my latest thoughts, and I'd be happy to answer any questions your folks have.
Wow, that's amazing. Thank you. Yeah, I just want to, there's so many comments, I can't read them all, but they're basically things like Dr. McDougall for president, Mary would be a great first lady, Dr. McDougall for Surgeon General. So many people watching, like Linda Middlesworth and others, saying it is because of you that their lives have been saved. So people really appreciate you talking to us. So thank you.
Well,
you know, you had mentioned, and you're not the only doctor that has said this, in general or on my show, about comorbidities and how being overweight or obese is definitely one for COVID. Yet you and I, well, I don't know if you know this, but before we came on the show, I posted a photo of us on social media, on Facebook and Instagram, announcing your upcoming appearance. And most of the comments were, oh, to my two favorite people, my hero, we look great. But a few people were saying how sickly we look because we're so thin. So how do you feel about that? Because it seems like that is what's going to protect us from this pandemic, or one of the things.
That's right. That's right. You know, you could find pictures of me from 40 years ago where you would say I look too fat. You know, I'm 140 pounds now. And a good share of my life, I ranged between 150 and 160. And there was a time that I was 180 and preaching a good diet, but unfortunately I was traveling a lot. And there was a time, even before I understood the importance of a good diet, when I weighed as much as 230 pounds. So, you know, it's all relative. My wife married me, Mary married me when I weighed 200 pounds. She thought I was cute. You know, so it's all relative. I'm happy with the weight I'm at. And, you know, hopefully it reflects the good health that I feel I'm in.
Well, we all think you look great, Dr. McDougall. A lot of people are asking about your thoughts on the vaccine.
Well, I think the vaccine is a lot of hopes and dreams. It's happy talk. I would like a vaccine to be real. There's nothing I would rather have than for us to be able to go back to school, go back to work, etc. And a vaccine is the key to that. But realistically, if you listen to the experts, they'll be telling you the same thing I am, that, don't get your hopes up too high. We've never had a vaccine against a corona vaccine, cold vaccine before. And there are just so many obstacles to making a good, effective vaccine. In fact, they've made ineffective, although promoted as effective vaccines for the flu for as long as I can remember. I did a whole discussion on the flu and the influenza vaccines and why I refused to get them or refused to have my family get them and why it's a fraud. And I present the scientific evidence for you. And you'll see it's a fraud. Now, do I believe in immunizations in general? Yes, I do. All my children and grandchildren are fully vaccinated for diphtheria, tetanus, polio, hepatitis. I've seen these diseases. Don't throw the baby out with the wash water. But, if you're living for the day when a vaccine is developed against COVID-19, I think you're selling yourself, your community, your family short. We have, and our experts keep saying this, listen to the scientists, listen to the experts. They keep saying this. We have the tools to mitigate this. And if we instituted the diet you and I know to be so true, whoa. I mean, consider that during the SARS-1 infection, which ended in 2004, the incidence of death in Vietnam from the SARS-1, which ended in 2004, so we have good data on that, was 8%, whereas the incidence in Toronto of death during that same SARS epidemic was like 16%. This, to me, reflects the general healthfulness in comparison of the Asian diet to the American diet, which, of course, is rapidly changing. The Asian diet is becoming much higher in animal foods, much higher in vegetable oils over the last 20 years. So these kinds of figures that I give you are changing rapidly as your Asian is becoming more typical, a person who eats the American eating habit. So the evidence is just overwhelming. Plus, you have to go back to, you do no harm when you make this kind of decision. It costs you nothing. It supports every other aspect of the world. I put up on that one chart, I put up other factors that were involved. If you notice that, if you get a chance to go and look at that chart I showed of the integration, showed other factors like personal appearance, like diseases, like hunger, even racial issues have to do with what's going on now. People are talking a lot about how people of color, Hispanics, blacks in particular is what they're focused on, have a higher risk of, twice the risk of going on to severe complications, hospitalization, need for ventilators, death, as would be whites. And, they blame it on certain things that I'm sure are true, like social factors and closeness to habitation, et cetera, family, community, et cetera, all kinds of other factors. But one of the things that they haven't focused on, again, which is something that we have 100% control over, is the food of these folks. You will see that these people, if you look back in their ancestry, back into the Hispanics, back into the Africans before they became African Americans, or populations that were still left in Africa, like the ones I talk about that Dennis Burkitt took care of in Uganda, you will see that these people had none of these problems, no obesity. Remember the story, if you don't remember it, look it up on my website, of Dennis Burkitt. Oh, he took care of people in Uganda in the 1960s and 70s. He took care of 10 million people in Africa. He saw no obesity. He saw one case of gallbladder disease, one heart attack, no gallstones, no colon cancer, no prostate, none of the American problems. And rural Africans in Uganda, Africans in the United States of America in the 21st century are some of the sickest, fattest people in our country. Why? Because of the food. It's the food. And so if you look at the data, blacks have more prostate cancer, more risk of dying of prostate cancer, twice the risk of breast cancer in a 48-year-old age woman, if she happens to be a colored versus white, more diabetes, etc. It's not a mystery, ladies and gentlemen. It's the same common denominator. It's the food. So, we have to fix the social things, no question about it. I don't want to minimize those. But it's the food, and we can change that immediately. It's in that same food, people are becoming hungry and starving all over the world for it. And you may know the data offhand, I'm sure most of you do, that we could increase the food production by 10, 20, 100 times if we switch from animal foods to starches. So we could relieve the world hunger. It's just so many things that could be solved if people would focus on the food. We have a job to do. AJ, Linda, the rest of you folks out there, don't let them up. We got a job to do.
Well, we're here to help you, Dr. McDougall.
I do. Never mind. Yeah.
No, go ahead. You can say anything you want. People are asking Dr. McDougall if we know what the diet is, but are there any specific foods within that diet that will help protect us even more? And what are your thoughts?
No, and you have to stop looking at it that way. You're not going to add a special pickle or a special leaf or some special thing to cause some special effect. It's the basic diet, just like clean air, clean water. These are basics. Clean food is starch, fruits, and vegetables. You try and manipulate the diet by adding herbs and special foods and so on, then you're taking in causing effects. Some may be positive, some may be negative. The diet was designed by our creator eons ago. And I don't understand it, but I know it's right. I know it's right. I've seen it right in every aspect. Religious points of view, all religions teach this kind of diet. Women's rights. Speaking of rights, we have a campaign out here, AJ, and we're a campaign of Black Lives Matter. A very sincere campaign that, talking about it, I don't want to take my sincere concern and appreciation for what's going on away from it. But I do want to note that the people who say Black Lives Matter, there's a whole other group of people out there. They are headed by Greta Thunberg, who says young lives matter. And during this COVID epidemic, there are a whole bunch of people out there in our age group who say old people's lives matter. You see, old people are accused of having it rich, having it fat, not wanting to change. They're accused of ruining the future for the young people. And so the young people are asking old people, me, young lives matter, change so we save our environment, our future. Now with the COVID-19, us old people are saying, young people, you save us. Even though you may not get so sick from this virus, we will die, save us. All lives matter. Hey, ladies and gentlemen, all lives matter. And food is central to everything we do.
Well, we agree with you, Dr. McDougall, and I don't know why they keep messing with the diet and doing all these tweaks and additions and worrying about deficiencies.
Gimmick. And plus, you can always sell a gimmick. If I can develop a gimmick to sell you, I'll sell you. Like I say, we were able to reduce the cost of our program by more than half, and bring about more effective teaching. Hopefully, we'll get to everybody in the world, AJ. It's my hopefully not my last. Hopefully it is my last necessary attempt. I've tried and failed and tried and succeeded and tried and failed. Let's have a big success this time because so much depends on it. So it's not just whether you die of diabetes or lose your leg function or your bladder function from multiple sclerosis. It's not that insignificant. It's so significant that we're talking about the entire world's finances. We're talking about death of maybe the entire population, world extinction. Get real. We have to act.
Doesn't it drive you crazy though that you've been saying this for so long and people don't listen? Because I've been doing it far less than you, and especially the starch component. Because even people that are vegan are now saying, well, vegan keto and oil is good for heart disease and starch is. I mean, people still vilify starch when that is the only thing that ever made me thin and healthy.
It's the only thing that makes sense. The only thing, the data, the scientific data, the religious data, the epidemiologic data, all the data supports the same thing. It's only people's own dinner plates. The fact that we were raised on fried chicken and ice cream cones, that we can't see past our own dinner plates. It's like a smoker trying to justify quitting smoking. They can't see beyond their bad habits, or a drunk. They can't see that this is destroying themselves and everybody around them. Same thing with the food. You can't see the amount of destruction if you're buried in that kind of meal. You can't see what you're doing. And it's only those of us who have made the transition to this clarity of thinking, because we've changed ourselves, we see it's possible. And that's why COVID-19 is so important, because it's made the entire world realize that we are capable of changing. And we can make the same changes that need to be made to save the planet that we've made to save ourselves acutely, and some of us have made to save ourselves from chronic diseases. It's all so simple. It's all so clear. It's all so easy. It's the truth.
Yeah, and you always say the truth never changes. What are your thoughts on hydrochloroquine, people are asking?
Well, I'm a scientist, okay? I can only listen to the science. I don't know anything more about the science than you do. The scientists say that this is a bunch of political, I'm not going there.
You can. You haven't. I will never censor you, Dr. McDougall.
It would do nobody any good to bring this into a political issue any more than everybody understands. But, if you could make the same discussion about the food with other issues that are going on today. I tried to explain to you that Trump declared the meat industry a necessary industry for the survival of the U.S. and forced all meatpacking plants to stay open amongst epidemics where, a large number, if not the majority of people in that plant are getting infected and spreading the disease to their community. Makes no sense at all, especially since, we should know better. Meat is the last thing. It's the first thing we should get rid of, the last thing we should preserve. For a whole bunch of reasons, all the way from the infection problem to the brutal treatment of certain groups of people. It just goes on and on. Don't ask me to justify this insanity. This is insanity. Pure and simple insanity. AJ, I didn't believe up until 20 years ago that I would live long enough to see the end of the world. I believe different now. And I'm not looking forward to it either, to seeing it. It'd be a lot easier for me to just leave, but I guess I can't. I guess I won't. And I won't lose my optimism either. I think we can save the world. I really do. I wouldn't tell you that if I didn't believe we could. I don't think it's going to be easy. It certainly is not a given, just like nothing's a given nowadays, or never has been. If you think it's going to be an easy fight because we have the truth on our side, then you're not over the age of maturity for sure. You haven't had the experiences you need to have in life. We gotta fight tooth and nail. We really do. All of us, Forks Over Knives, E2, Furman, everybody, AJ. We got to get, I've always said we have to stop the diet wars. We need to all unite. I've been teaching this for 20 years, you know that.
Well, people are saying your passion is as good as your research. How do you want to, not that I expect you to go anywhere soon or want you to, but how do you want to be remembered, Dr. McDougall?
Well, I would say that somebody who gave people the option to know better. It's never been really important what you do, because I'm a teacher and I feel my obligation is for you to know what you should know. And so I've always felt that my duty was to give you a proper education. And unfortunately, that's just not as easy as telling people that. That's involved things like writing 13 national best-selling books, doing weekend seminars for dozens of years, adventure trips, 34 years of residential programs, now a telemedicine and a teleeducation program. I've dedicated my whole life, AJ, to trying to figure out how to get people to understand what to do and to help them do it. Whether or not you did it, well, I realize that that involves other factors than myself. Whether or not you learned it properly is my responsibility. So I would like to be remembered as an educator, as somebody who was able to clearly, honestly, without any thought of bias or distortion, was trying to teach a message that was not only honest, but practical for people. That's it.
That's great. We have a lot of doctors watching, including Dr. Nikki Davis, who says, "Thank you, Dr. McDougall, for being my inspiration to become a plant-based physician and helping my patients transition to a starch-based diet." So,
Well, you have a great audience, AJ.
well, they'd like to, you haven't been here since March.
The enthusiasm of, is great.
Well, you have an open invitation. We didn't decide to do this till last night. You haven't been around since March 20th because people really missed your weekly webinars and they love hearing from you. Because
we're starting those again. We're starting many things again. I took a little time off, well-deserved time off, and now I'm back. Watch out! I'm back and I'm better than I ever was, AJ. I don't know whether you can see it or not. I may be a little older, but I'm a lot more well-seasoned and I can see a lot more clearly than I used to see before. Something about old age that removes some of the cobwebs that keep you from really seeing what's going on.
Yeah.
So I have to say, I've reached that group that is called elderly.
Yeah. What has been the highlight of your professional career up until now?
Excuse me. I would have to say I've taken most enjoyment in individual patients. Yeah, I would have to say if I had put my stock in saving the world and making great, grandiose accomplishments, I would have been a very frustrated, unfulfilled person. But I decided long ago, since that wasn't a reality, that I would take enjoyment in helping the individual person. So what I like most is to see people come back and really mean it and say, "Thank you for helping me. I got rid of my lifelong weight problem like you did." Or other people who say, "My multiple sclerosis stopped progressing," or "My chest pain went away," or whatever. That is the reward. Helping other people is the greatest reward in life. Now, probably the greatest reward of all the rewards is when I get a email. It's usually an email from somebody I haven't heard about for 2, 3, 4, 5 decades. Yeah, it could be as much as 5 decades. In 1977, that would be not quite 5 decades. In 1977, I gave my first lectures on this. And people will write me and they'll say, "Oh, I want you to know, I heard you lecture about 40 years ago, started your diet, and all my friends are inactive in nursing homes, etc. And I'm grandparenting, I'm having a great old time, still at work, things are wonderful. It's been a whole different life for me. Thank you." Then I feel like I've really done my job at helping somebody like that long term. And I have a half a century of work behind me that allows me to really know that Mary and I and the team have permanently helped people. And AJ, I am so excited about being able to effortlessly put this program in people's homes. Dr. Lim, our other doctors are going to come to your house by telemedicine. We've had a whole 6 months of experience doing this. If you are our patient already, we'd be happy to see you in follow-up. Without you attending the 10 or 12-day programs in the past, you know that the only way you get to become a McDougall patient is to attend one of our longer educational programs. And we invite you to become a patient. If you just happen to call up the office and say you want an appointment, have had no history of being through the 10-day or 12-day program, it's not part of our business. We don't have records on you. We're not going to do it. But those of you who want to be part of our practice, and there's going to be ongoing support, lots of personal interaction, and most importantly, you're going to have a doctor that really understands that the goal is to get you off unnecessary medication to avoid, quote, elective surgeries, and to get your health back and your personal appearance looking great. And we can do that. And now we can do it at half the price. And all you have to do is go to the website to get more information at drmcdougall.com.
Right. And we've posted the links, and people are pointing out how generous you and Mary have been over the years, just giving so many of your programs away for free. Pretty much except for the program, everything is free. And when the pandemic started, you even started giving away some of your paid programs for free.
Yes, we did. Well, it's always been our feeling that, as I say, it's better to give than receive. And that's where you're going to get your rewards. And we've gotten back so much. AJ, I have to tell you, there's no shortage in what we've gotten back in terms of success. Believe me, Mary and I have been very comfortable in all aspects of life. And most rewarding is our friends and family. As many of you know, that's really what it's all about, healthy friends and family. But again, there was a time when I thought that maybe my career was over. You know, some of you know some of the circumstances I've been through. But I just feel like my career is beginning. And I hope you see that. I really do. I feel better than I've ever felt before in a long time. And like I say, my thinking is more progressive and much more focused than it's ever been before. So watch out.
You think you would have been so successful if you didn't have Mary in your back pocket?
Of course not. You know, Mary's been my lifelong partner in everything. You know, books, the McDougall adventure trips. Can you imagine doing McDougall adventure trips again? We took thousands of people all over the world on cruise liners. And those days are over. Wow, what a different world. But that's okay. It's going to be a better world because the world we were living in was on a self-destruct road. We had no chance. Within 6 to 12 years, change would be irreversible. And maybe it's already happened. But let's not believe that. Let's go after them. Let's fight every day and night to save this planet and our families and everything, the species, the spiders, the snakes. Oh, yeah, don't get me teary-eyed.
Well, as much as we love seeing you, everyone's saying at some point they'd love to see Mary come on a broadcast too, if she's available.
Oh, sure. Well, let's plan one with her. And
we'd love to see her. And Colleen is asking if are you staying at home or are you going out now in stores? Because so many of even the plant-based doctors are not only anti-vaxxers, but they're anti-maskers.
Well, you know what? They're anti-information. I don't know. No, I absolutely take very, very strict precautions, even to the point of denying contact with my grandchildren. So no, I live in great fear. I think, based on what I told you, that my chances of having severe illness, as is Mary's, are much less because we're generally healthier. But you know, I don't think that we're invincible for sure. So yeah, we take great effort. So the next program that we're running starts the 21st of August. And you'll want to call the 800 number. You said you put it up there, 800-941-7111. Or write office at drmcdougall.com. We'll give you more information on it. And the way we work it is we'll have you seen by the doctor before the actual educational part of the program starts. Then after the doctor sees you, adjust your medications, which we will do on each and every visit. Our goal is to get you off the drugs. What we'll do is we have a couple of follow-up visits, medical follow-up visits scheduled for you. Some meetings with our psychologist, exercise people, group meetings with a dietitian, a lot of personal contact, daily support. We will have contact with people. We'll take their physical measurements such as the weights, their blood pressures, their blood sugars. We're going to run this program even more efficiently than we ran the residential program. And you should expect that kind of personal care. Hey, I'm supervising what's going on. So even though Heather's the official director of the program, and she is, I get a chance to give my input.
Well,
Of course, it's called the McDougall program, so what else would you expect?
Absolutely. If just give me 1 second, I have to ring the bell to thank Mary Davidson for her contribution. And Dr. McDougall, I was just thinking there are some people that are not working right now because of the situation, and this would be a perfect time for them to do your 12 days to dynamic health, because they may not have had the time before or had the time off work. So this is like the perfect timing.
Yep. It's the perfect time.
Yeah.
For millions of Americans to work. I think the other thing is the amount of money you save on your food and your medical expenses. And when you get healthier, you'll be more employable. In fact, I did an article, a newsletter article about your employability, which I think is very current right now. I'll ask Heather to put that up. And the fact that, who would you rather hire if you were an employer? Somebody who was sick and overweight, or an employee who looked good, felt good, had less chance of taking sick days and retiring early and being non-productive? Healthy employees are in demand. And good health is often reflected by body weight. The McDougall program is the best chance of you permanently staying or attaining good health, good appearance, and staying that way.
Absolutely.
Without a doubt. And without compromise. You know me, I'm not very good at compromising.
I agree. Dr. McDougall, you used to tell a story about, I don't remember if it was when you were at St. Helena or when you were a medical student, and one of your supervisors said, Johnny, you're never going to make it thinking like that. Where are those people now? Because you obviously have made it.
Irv Schatz is dead. He was my chief of medicine. I heard he died about 5-6 years ago. Great man, great doctor. He had life and death control over me, and it was during my residency between 1976 and 1978 at the Queens Medical Center at John Burns School of Medicine, where I became an internist. And I almost got thrown out of that program a couple of times, just like I almost got thrown out of medical school a couple of times because of my brazen personality. On one occasion, I saw a patient. It was he and his wife. He had 3 kids, had just had his 3rd heart attack. I asked him what he was going to do to prevent the kids from becoming fatherless, and he said, I don't know. I'm doing everything the doctor told me to do. And I told that patient, remember I was a resident, and his wife, that they need to change their diet. How and why, I told them. Well, that I got into big trouble for, because their attending physician came in a few minutes later. They told all this good news to their attending doctor. The attending doctor was offended. The idea being, if it was important, I would have known it. I would have been the one that taught this to you. So he went to my chief of medicine, Irv Schatz, told him that. And I was told to mind my P's and Q's, to say the least. The last, there are many times we encountered each other, but the last serious encounter we had was after I graduated, after I had my ticket, my certificate that I was a board certified internist. And I came into his office and he had a friendly father to son talk to me. He said, John, I really like you. I like your family, like your children, like your wife, Mary. But I'm afraid you're going to starve to death with all your crazy ideas about nutrition. All you're going to collect is a bunch of bums and hippies. I thought about it for a minute, and I thought about all the prescriptions that I gave people that were so harmful. I thought about heart surgery and breast amputation and cancer chemotherapy drugs. And I said to him, Dr. Schatz, I can't do this to people anymore. I know better. And I said, besides that, I don't think it's going to be bums and hippies that come to see me. I said, I think it's going to be successful people who have worked hard to get great education, great jobs, great families, great community, everything great in their life. And they stop along the way and they say, look at me, I'm such a big success. How come I'm so fat? How come I'm so sick? I told Dr. Schatz, as I pointed towards his own prospering abdomen, I said, Dr. Schatz, when these people ask this question, I'm going to be there to give them the answer. And they're going to listen to me. And that's the way it's been, AJ. My practice is made up solely of successful people. I don't mean they're all millionaires or business people, but they've expressed a success in life where they say, I'm worth it. I'm worth it. And they go to the effort of making these simple changes. And, all of us have looked back and said, boy, why didn't I do this a long time ago? This was so easy. And then you look at the people around you suffering so needlessly. And then you look at such important issues like the destruction of the American economy and 150,000 people dead in 6 months in the United States and the destruction of the planet. And you go, oh my God, how can this go on? It can't.
Well, Dr. McDougall, we all love you. We appreciate you. And you may say that your personality is abrasive, but we love you just the way you are. Don't change, because you really do. You are a truth teller, and you tell it like it is.
Thanks, AJ. Well, this is why you and I hang out together.
Thank you. And you have an open forum here anytime. And thank all of you so much for watching this broadcast. And is there anything else you wanted to say, Dr. McDougall?
Oh, I just hope I get a chance to see some of you folks on the 21st of August.
I sure hope so.
Yeah.
And you guys, thanks so much for watching this broadcast and sharing this broadcast. And please come.
And I hope you have opportunities for them to take this video and give it to other people. Do they?
Absolutely. We've had more shares. People can share this in real time. So guys, please help Dr. McDougall's cause. And
yeah, teach me what social media can do. I want to see what a viral video can do.
Everyone, you heard it from Dr.
We got a viral video, AJ.
It would be amazing. You're probably going to have to take your shirt off and show your tattoo for it really to go viral.
Yeah, really.
Do not stent, I will sue. Isn't that what your chest says?
Yeah.
That's amazing. That's amazing. Guys, thank you so much for watching. And please come back at 11 when we'll be talking to Tracy McWhorter about your greens versus your genes. Dr. McDougall, it has been such a pleasure and an honor.
All right,
having
AJ.
you.
Thanks. Bye, all folks out there.